All right. Dr. Grindstaff, let's talk a little bit about heel spur. And number one, what can be done? How is it treated this way? Perhaps what can be done to prevent it? And definitely, what is happening if people don't fix it? Basically, like if you don't fix a gum disease, well, you're going to lose your teeth, you're going to get kidney failures, you're going to, a host of problems going to occur. You simply don't want to have occurring. Maybe that's not the case with heel spur. Just going to ask you, what does happen if you don't fix it? All right?
Sure. Well, if you don't fix heel spur, it's not like gum disease where it's going to kill you from infection or kidney disease or anything else. What it does is it produces, of course, pain, and because you have pain, you don't want to exercise, and it hurts to do that. And the more you try and exercise, the more it hurts. And so often people that have heel pain like this gain weight because they can't exercise, and oftentimes they even get heel pain trying to exercise. And so the negative part of this deals more with perhaps things like obesity and trouble losing weight when your heel is hurting.
And of course, being not quite as alive, refusing one too many, let's go and dance with your spouse, or overall, let's take a walk in the park. We used to enjoy that, but all those type of things which are quite, sometimes they're the highlight of our life. Those type of things. Yeah. That's what we live for, right?
Sure. I mean, when your heel hurts like that, you don't want to do anything, and it becomes a vicious circle. The less you do, right, the more your life is affected. And so, as you say, the enjoyment in life can be ruined by something like heel pain.
Good. Let's talk about how to fix it. What are the ways to fix it? Can it? Let me just answer literally like a lawyer. I'm a lawyer now, and you're going to tell me yes or no, and nothing else is accepted. Can heel pain, heel spur, same thing, right? Am I right there?
Yes.
Okay. Can heel pain, can it be fixed or not?
Yes, it can be fixed, most certainly.
Good. Now tell us how.
Okay. Well, about 90% of heel pain gets better with what we'll call conservative treatment or the relatively simple things. About 10% of people with heel pain will require surgery in order to get rid of the pain. Now, in the 90% group, some of the most common methods used to treat heel pain include things like orthotics. We've talked about this in other videos, but orthotics are extremely important in treating heel pain. Simple things like stretching, runner's stretch, leaning up against the wall and stretching, and taking a towel, pulling it over your foot and pulling it back. Stretching is very helpful. Along with stretching there's the device called a night splint that people can sleep with that stretches their foot while they sleep, so that when they get up in the morning, it's not nearly as painful. The physical therapy, things, ultrasound, electrical stimulation, ice treatments, various kinds of simple things like this can oftentimes get rid of heel pain.
Are there ultrasound machines or devices, whatever you might want to call it, which a person can have at home so he doesn't have to place himself to a medical office all the time?
Well, yes, there are devices. One of the common devices that you can use at home is a thing called a TENS unit, which is a little electrical stimulation unit. It has a couple of electrodes that go on your foot, and you turn this little dial, and that can be used on a home basis. Actual ultrasound machines are probably difficult to use at home. And so most of the time those are done in either an office setting or at the physical therapist's office. But certainly there are things like that can be done. There are other gadgets that are used that are fairly simple. Silicone is a wonderful padding device that can be used in the heel of a shoe. And there's special silicone heel pads that people can get very inexpensively and help their heel pain significantly.
Got it. So would a person, when he goes to a podiatrist, would a podiatrist be able to pretty much relatively accurate to see whether that person falls under the 90% of conservative treatment, where like an orthotic would do the trick, probably, most likely, or where he goes, oops, it's surgery time. Is that relatively visible?
Well, most of the time the way it's done is before we would consider surgery on someone's foot, we usually make sure that we've tried at least 3 different kinds of simple treatments. And they could include things even like even cortisone shots in the heel and things like that, orthotics, padding, shoe changes. All these kinds of things are done before one considers surgery. Now, oftentimes someone will come to my office that's already had several of these treatments, and then they're sort of further down the line and they may require a surgery. But most of the time, the simple things are tried first.
Right. And even like if a person, let's just say, I'm looking at the money thing here. A person gets an orthotic. It's not exactly super expensive, but it does cost a little bit of money, a custom-made orthotic.
Sure.
So he gets that. It doesn't quite work. He needs surgery. It looks to me from other things you told me about orthotics, the orthotic probably wasn't 100% waste in any case.
No, you're absolutely correct. Even after surgery, in fact, when we do surgery, most of the time when we do surgery, we do what's called an endoscopic surgery, which means we make a tiny little incision about like this on each side of the foot, and a scope is placed in one side and the blade comes in from the other, and the ligament is released, just a small piece of the ligament. After this type of procedure, within a couple of days, we have just some Band-Aids over those areas, and we get people right back into an orthotic immediately. And so even if they've gotten an orthotic, and as you say, it didn't completely solve their problem, it's absolutely something that they need to be wearing even after surgery.
Okay. So if you tried before, hoping it is without surgery, then he needs it anyway. All right, wonderful. Now, if a person gets a surgery, so what does that entail? Does that entail a week, a month out of your shoes, laying in bed? What are we talking about here?
Well, the surgery is done, first of all, as an outpatient surgery at the hospital. You go in, you have it done, and an hour later you go home. As I said, tiny little incision on each side of the foot, usually 1 or 2 stitches is put in on each side of the foot. The bandage that's on that day is left on for a couple of days, and then that's taken off, and a small Band-Aid and a little bit of triple antibiotic ointment is put over those spots. And at that point, people go back into a tennis shoe type situation with their orthotic. And it takes about 6 weeks, though, for the inside to completely heal. Now, the skin, the 2 little stitches come out in a couple of weeks, but the overall inside takes about 6 weeks to heal.
Okay.
And
now, can the person go to work next day or the day after, or how fast is he back on his feet if he is not a super athlete, or I don't know, something like that?
Well, for most people, they can go back to work they would take like a long weekend to do something like this. Say if they did it on a Friday, they could go back a Monday or a Tuesday. That would be a typical person. Now occasionally you have people that are, in a job where they have to be able to run and jump and do things like that. And those are different altogether. They have to wait or be on a light duty or something like that rather than go with back to their normal employment if they're in a really strenuous job.
Right. Okay. Anything more about heel pain or heel spur, which we should know?
Well, there are other ways that it's being treated besides just the kind of surgery we just talked about. There are one of the newer things that's being done is the ligament itself is basically, if you will, zapped with a needle several times, and what that does is it brings blood supply into the ligament, and the body can heal itself. And it takes very little disability afterwards, and so that's a much newer and common procedure that's being done. Other procedures that we have done for heel pain include something that is called shockwave treatment, where a high energy shockwave is shot into the heel of the foot, and that you don't even make an incision on the foot, and that in about 50% of the cases will successfully get rid of heel pain.
Wonderful. So there definitely is a variety out there, and I think I heard you mention in another video that we do need to acknowledge the fact that not every procedure works for every person, even though overall the symptoms might look like totally the same. The illness may be the same, and that's the case with everything. Not every drug works for everything in business. Not, right now our government, they can look at whatever they want to, what happened in the 30s, what happened here, how to fix the financial problem we're having. Same situation doesn't necessarily respond, and maybe it's just our inability to see the small difference. Whatever it is, it is a little bit of like, all right, here we have a great chance of fixing it with this, but if that doesn't do, we have to do this. And in the end, what other choice do we have rather than keep going and keep fixing it? And let's be happy that we, I guess, have a bunch of stuff to use.
Yeah. Yes, heel pain, there are many, many treatments, and as you say, they don't all work if one thing always worked for everybody, that's what everybody would do.
And there would be no problems in the world whatsoever, right? If one way of raising kids would work, well, all kids would be fine, but we can see that even in a family which apparently raises 3 or 4 kids the same way, apparently, I'm not even saying they do, but apparently they do, they do turn out different.
They don't always come out the same.
No,
you're right.
Not necessarily worse and better either, just different for sure.
That's right. That's for sure.
Thank you very much. Very, very enlightening the way you were telling us, basically what's all available out there. I really appreciate it, and I'm sure that people watching this video will. Thank you very much, Dr. Grindstaff.